says he's not going to touch the deficit. This isn't going to affect the deficit at all. Somehow we are miraculously going to pay for this thing and not put our country further into debt. I mean, what do you say to that?
Well, ladies, with all due respect to our president, I know he's well-meaning in what he wants to do. But, you know, I've been a private business owner apart from my medical practice for many years, and I can tell you that he's being very contradictory in his statement. He says that Medicare and Medicaid is unsustainable. Well, he wants to take that small model and enlarge it for the rest of our economic medical economy. And so what we're going to get is even worse problems with cost control rather than less. He, of course, has set all these targets for lowering cost, and he's met with various medical groups, but there's been no realistic attempt at actually showing how those savings will come about. And at the end of the day, I think we can all agree that we need competition, healthy competition between organizations that are privately run to get prices down, quality of care, and patient service up. And this doesn't do that. This just gives us more of what we have, which only works now because of subsidy.
But you talk about competition to bring prices down. We also have that in the healthcare system, and we have tens of millions of people who don't have insurance, and we have costs that keep going up. Don't ultimately we need something for people to consume less health care in this country? You give it to insurance to people who don't have it, but those who do need to use less health care.
Well, let me clarify a myth for you. There is not competition in the healthcare economy. We're working on a price control system and have since 1986. Both the government, through Medicare and Medicaid, and private insurance dictates what I can charge patients. And they've ratcheted that reimbursement down progressively over years. And what happens is doctors and hospitals alike end up increasing volume, sometimes very artificially, in order to make enough to survive. So no, we don't have a healthy competitive environment. We can do that, and of course, with the Republican plan, we've actually come up with a system where we can have healthy competition between providers and organizations. And again, a good model for that is Part D Medicare, which is the only part of our economy that's government run that actually has healthy competition.
Congressman, stay right there. You're going to be with us the whole hour. Thank you, Congressman Fleming. We're going to take a quick break, everybody. We have many more guests and lots more time to take your questions. 877-249-9626. The email address is yourmoney@foxbusiness.com, so get busy.
Because we're up, it's Saturday, and we are the only business network live in HD. So you can see us, call us, and talk to us for the next 4 hours.